Hello, everyone, and welcome to our webinar. Thank you for joining us today. My name is Mohamed, and I'm the Medical Project Coordinator at HITL. I will be your host today, and we are excited to have a special guest with us today, Georgi, who is representing our client, Kelvin Health. Kelvin Health is at the forefront of medical innovation using advanced AI technology to detect vascular condition, inflammatory disease, and oncology-related anomalies through thermography. Today, we will be discussing their groundbreaking work and the role of HITL in supporting their project. Welcome, Georgi.
Hey everyone, it's such an honor for me to be here, to be part of this webinar series, and to be able to tell you the story of Kelvin Health and the innovation behind how we combined essentially thermal technology with artificial intelligence. Thank you, Mohamed, for the introduction.
Thanks, Georgi. Peripheral arterial disease is often referred as a new pandemic affecting nearly 15% of the world's population and resulting in around 150,000 lower limb amputation every year. 1 in 3 diabetics over 15 years old suffers from peripheral arterial disease. What is the role of Kelvin Health technology in diagnosing peripheral arterial disease?
Yeah, so unfortunately, yes, the peripheral arterial disease is a huge pandemic globally. I just shared my screen with a slide showing some statistics now that are quite relevant and recent. So unfortunately, more than 200 million people worldwide suffer from PAD, and because of the hard access to precise and timely diagnostics, each year above 20 million people, or more than half of the population of the average population of a European country, develop critical limb ischemia, a condition that first takes your limb and then kills you in less than 5 years in almost half of the cases. Due to some severe blockages that require amputations. And unfortunately, due to the fact that amputations also require some recovery procedure that is usually very, very tough for the patients with COI that are at old age or around 70. They don't recover fully or completely, and at the end of the day, this leads to a lot of deaths. At least 50% of patients with amputations die, and all of this is due to the hard access to vascular diagnostics, because most of the patients reach the office of the vascular specialist when it's too late. Usually they have symptoms that are mostly similar to symptoms of the orthopedic conditions or neurological conditions. And when they visit their general practitioner first with the symptoms that they have, the general practitioner thinks that this is an orthopedic issue. But when they visit an orthopedic specialist, they immediately see that this is definitely not an orthopedic issue, and this is something that a vascular specialist will need to look into. And when they reach the office of the vascular specialist, unfortunately, it's too late. It's usually the condition has progressed to the point that it's a critical limb ischemia, and to the point that it requires an amputation. So essentially, they need a methodology. These patients need a methodology that essentially can diagnose them precisely and rapidly. However, non-invasive solutions like archaeobrachial index, for example, or Doppler ultrasound take quite some time and are very dependent on the specific experience of the operator, of the examining specialist, and oftentimes unreliable, leading to even more deaths, even more false positives, especially for patients with diabetes that have this minor calcification of the arteries that leads to a lot of false positives with these particular devices. On the other hand, we have the X-ray angiography, which is the golden standard for current diagnostics of peripheral arterial disease. But it is a very invasive procedure. It requires an injection of contrastive agent and several hours of radiation, which typically also ends with some type of hospitalization. So almost 4 years ago, initially provoked by the COVID-19 pandemic, we decided to apply our long-lasting experience in artificial intelligence, in machine learning and image recognition, and built a diagnostic solution as simple as taking a few thermal photos of the legs of the patient that will be able to be used by the specialist, the general practitioner, the nurse practitioner, to quickly diagnose and to triage the patient into the accurately into the particular condition, into whether the patient has peripheral arterial disease, whether the patient has progressed into critical limb ischemia, or whether the patient has other types of medical conditions. And using a thermal camera like this one that I show on the webcam, using this small thermal camera, just this small thermal camera, we can capture the heat of the body, detect local blood flow anomalies, and notify the healthcare professional if needed of what would be the next best steps for this particular patient.
Yeah, great. Thank you for providing this information and these accurate statistics. The AI model you use reduce service cost and offer faster service. How can Kelvin Health technology help with this?
Yes, so essentially, let me show you how the current patient journey looks like, because this is the best way for you to understand where Kelvin Health is situated and how it essentially what value it creates. So on the slide, you can see a very complex diagram, but honestly, it's not that complex when you dive deep into it. It currently shows, the diagram shows both processes, the standard process that is currently active in the healthcare system and the process where Kelvin Health is being integrated within the patient journey. With the standard process, when the patient first visits a specialist, this is after 2 or 6 weeks of going through different specialists, going to the general practitioner, to the point that it is accurately navigated towards a vascular specialist, then it undergoes an ABI diagnostic procedure. So anchiobrachial index is a very quick methodology, around 15 minutes. It takes around 15 minutes that calculates the pressure, the blood pressures of the arm and the legs, and calculates a ratio between these two blood pressures to understand what is the index, the anchiobrachial index. And based on this index number, the specialist decides whether the patient has potentially anomalies related to the blood flow or not. Unfortunately, this particular procedure has quite a lot of false positives, and usually most of the specialists also require or recommend the patient to undergo a Doppler diagnostic procedure. The Doppler diagnostic procedure uses ultrasound device, which essentially requires an operator to navigate using this ultrasound device towards the specific arteries in order to find where the blockage is within the body. Unfortunately, due to the fact that it is operator dependent, it also has a lot of false positives, as I'm going to show you an example later on. And this leads to most of the cases for most of the specialists to recommend also to undergo angiography procedure, especially if the specialist is suspicious that there is potentially an issue underlying, an issue related to the blood flow. And the angiography, as I mentioned, is a very, first of all, invasive procedure, costly procedure, and takes around 3 hours to complete. But most importantly, in the Western countries such as Germany or US, at least 30% of the angiographies that are done on patients are unnecessary. This means that these patients didn't have any peripheral arterial disease developing in their bodies, and all the costs related to the angiographies, all the invasive procedures, even the hospitalization that was related to this was unnecessary. And everything related to this is all due to the fact that both ABI and Doppler are a full accuracy with a lot of false positives, and the specialists don't want to over depend on them, and that's why they usually decide to also do angiography on top of the Doppler and ABI. Whereas in the case where Kelvin Health sits, it tries to kind of replace both ABI and Doppler, and to use it both as a triage and as assistive diagnostic procedure in the beginning, in the very beginning of the whole patient journey, and to quickly understand the patient condition just by taking a few photos of the legs. And this takes around 3 to 5 minutes. It is even a much cheaper solution, and very quickly and very accurately can suggest what should be the next best step for the patient. Should the patient undergo angiography diagnostics to confirm the condition and to localize it as well in order to be used that for the revascularization procedure? Or should the patient go home for follow-up monitoring later on this in the year? And essentially, all of this optimization leads to at least 15 to 36% or times reduction in the pre-procedure time, which leads to at least 28% saved angiography costs. And all of this leads to a better triage and favorable patient outcomes. And most importantly, the Kelvin Health solution can be used by a non-specialist, because the actual secret of the solution is the artificial intelligence. The artificial intelligence is the technology that provides automatic insights about the patient's condition, and it doesn't require any specialist expertise. It doesn't require any specialist knowledge to do that. It just requires somebody to take the photos accurately of the patient's lower limbs, and these photos then to be analyzed by artificial intelligence, and the results to be provided to the specialist. And then the specialist, of course, decides what is the next step for the patient. So to summarize, we can replace part of the current vascular diagnostics workflow and enable rapid triage and further clinical decision-making support. And this solution is leading to substantial cost saving for the hospital, time saving for the clinician, and much better outcome and quality of life for the patient.
That's great. Thanks, Georgi. The entire process is clear now. So the early detection and treatment can prevent diseases from progressing, reducing the risk of complications and improving the long-term health. Early intervention is also generally less cost than treating advanced stages of the disease. So what is the role of Kelvin Health in the disease early detection?
Yes, so the whole concept of early diagnosis using Kelvin is possible because our local body temperature is directly related to our blood flow, and there is a limited number of factors that can affect it, such as inflammation or blockage. For example, blockage, which is directly correlated to peripheral arterial disease, it relates to blockage in the blood flow in major arteries, which leads to lower temperatures in the particular region where the blockage happens. Whereas with inflammation, we have an increase of the local body temperature in this particular region where the inflammation happens. For example, inflammation could be like the COVID-19 virus infection. Inflammation could be due to, for example, a bite from a mosquito, or anything related to the kind of process related to inflammatory procedures. And in case that we have an oncology condition, then we talk about a metabolic procedure, because the oncology condition relates to tumor cells requiring oxygen to reproduce, and the oxygen is only transported using the blood flow. And in order to reproduce, they require a lot of blood flow, which increases the local temperature, which essentially is the main marker for oncology conditions such as breast cancer. Whereas with spasm, we have lower blood flow in this particular region where the spasm happens, which relates to lower temperatures. And this local body temperature is usually a symptom that first appears in at least 99% of the medical conditions that happen in our body. And then the other symptoms such as pain, clarification, or swelling, they happen later after the local body temperature changes. This is something that I also essentially witnessed firsthand when I was testing this solution initially in the first months of developing the Kelvin Health artificial intelligence algorithm. And I was taking a lot of photos of myself, of my face region, of my neck on a daily basis. At some point, I quickly understood what is the typical thermal footprint of my face. And one night I saw that there is a huge red spot around my neck, like a very low warm spot around my neck. When I touched it, it was really warm, but I decided that it may be either an issue of the algorithm, or it may be something that I have been doing over the day, like physical activity or something like that. So I disregarded it as unimportant. But the next day when I woke up, I had sore throat. And this was an example of where the local temperature increased before the pain appeared. And the pain appeared the next day. So essentially, this proves that Kelvin Health or thermal imaging can be used for early diagnosis of a lot of conditions, a lot of medical conditions, not only vascular conditions, but also, as you saw, viral infections, peripheral, rheumatoid arthritis, as well as breast cancer. And essentially, to give you an example, here is a visible distinction between a thermal image of a healthy patient on the left and an image of a patient with critical limb ischemia on the right. So the healthy patient on the left has symmetry both horizontally and vertically. This is usually a normal picture of a healthy patient. A healthy patient usually has symmetry on both sides of the body, on both sides of the arms and the legs. Whereas patients that have some kind of a local temperature anomalies and medical conditions, they have asymmetry either horizontally or vertically. In this particular example with the critical limb ischemia, there is a blockage around the knee level, and that's why the patient in this particular example has lower body temperatures in the lower part of the legs rather than in the upper part of the legs. So the green, yellow, red spots, they relate to higher body temperatures, whereas, not body temperatures, skin temperatures, whereas the bluish, purplish regions refer to lower skin temperatures. And this essentially is used by the artificial intelligence algorithm to automatically detect whether this is PAD, whether this is breast cancer, or any type of medical condition.
Great. The diagnosis technology looks very brilliant and smart. What is the difference between traditional methods of diagnosis and your technology?
Yes, so in the context of vascular pathology, where Kelvin Health has the capacity to enable rapid and efficient non-invasive triage, there are a lot of advantages comparing it to the traditional methods. So first of all, out of the box, we provide better sensitivity or less false positives when diagnosing patients, comparing it to ABI or Doppler ultrasound, where they're operator dependent or either have very false positives due to the nature of the technology, like ABI, for example. Also, this method of Kelvin Health is quite applicable for patients with diabetes, in contrast to ABI and Doppler ultrasound, which is not very applicable due to the, as I mentioned earlier, minor calcification in the arteries that happens that could create potentially a lot of false positives when being diagnosed with these particular methodologies. The cost of examination is also something that is really important to be noted here. It is much cheaper than Doppler ultrasound and 30 times cheaper almost than X-ray angiography. And so it's very importantly, comparing it to X-ray angiography, it is a non-invasive method. It doesn't require any touches to the skin of the patient. It doesn't require any contrast agents. It just requires the patient to be sitting still for up to 3 minutes, and for the thermal camera to take the photo automatically, and this photo to be automatically analyzed. And most importantly, comparing to all of the rest of the methods, it is operator independent. So it means that it doesn't require any specialist to take these photos. It requires any person that just follows the procedure that we have defined correctly to take the photos and to submit them to the AI algorithms. This, on the other hand, allows for remote screening of the patients, because this particular methodology can be used potentially in the future at home by the patients themselves or by some nurse practitioners that visit the patients.
Awesome. So your technology has a great impact on the doctor's work and the patient health. Would you mind show us how it has impact on that?
Yes, of course. So over the years, working on the vascular conditions and together with the medical team of our medical scientist, Professor Petrov, we dig deeper into this particular application of vascular conditions. And we found that Kelvin Health can be us telling even positionally about severe blood flow problems as the golden standard of X-ray angiography. In this particular slide, we have the same patient first diagnosed with X-ray angiography, and this is the imaging samples from the X-ray stitched together so that it is easily visualized here on the slide. And on the right side of the slide, we have the thermal scan of the same patient. So what we can see here from the angiography results is that there are two arteries starting from the legs, from the both right and the left leg, reaching to the level of the knee, and below the knee level, these two arteries disappear due to some blockages around there in this particular region. And this particular example of the angiography directly correlates to what the thermal scan shows. The thermal scan shows that below the knee level, the temperature drops significantly. You can see how from red it goes to green to blue up to the point that it is purple. This means that there is some issues here, local temperature anomalies here related to blockages. And this particular image, thermal image, was taken in about 30 seconds, and the specialist saw this image in about less than a minute, and show the results of the AI in less than a minute, and quickly decided that this particular patient has a blockage. Whereas with the angiography, it took 3 hours of specialist time. It took a lot of cost involved, both from the patient's pocket, and from the healthcare system, and it required an invasive procedure. It also required radiation exposure. So you can clearly see the benefits of using Kelvin Health here. Our vascular specialists were so excited by this application of Kelvin Health in the context of vascular conditions that they even tried experimenting with different vascular pathologies, such as carotid hypoperfusion or blockages in the carotid artery. So the blockages in the carotid artery could lead to very lethal conditions, very lethal stroke conditions, situations of the patient. And this particular patient had blockages in the internal carotid and external carotid arteries, which could be easily visible by the thermal scan by seeing a very clear differentiation between the right and the left side of the face of the patient. The right side of the patient's face was much colder than the left side of the patient's face, which correlates to some kind of a blockage in the carotid artery in this particular example. And after stenting or revascularization of this carotid artery, or in other words, removing the blockage of the artery, we can see that the face temperature normalized to the point that it almost looks symmetrical on both sides. And this, again, is, I mean, the thermal scans are again taken in about 30 seconds and can quickly present to the specialist what is the current situation, what is the current state of the medical condition of the patient. And this is a very interesting example. This was a patient that has been diagnosed using Doppler ultrasound, but the Doppler ultrasound the operator didn't find any blockages in this patient's legs. Unfortunately, the patient continued to complain about pain in the legs while sitting, while walking, and etc. And thankfully, the next day, they tried to experiment with the thermal camera and decided to take a photo of the patient's legs with the thermal camera, and quickly realized that there is an issue with the patient's legs. This is what they immediately saw. They saw that there is a very clear differentiation between the lower and the upper part of the legs, which could correlate to some kind of a blockage. So they immediately decided to do angiography diagnostics on the patient, and essentially quickly found out that the patient had a major blockage in one of the arteries in this particular region. They immediately vascularized the patient or did a revascularization surgery, which improved the patient's outcomes. It improved his health. It relieved his pain, and essentially saved his life. So this is an example of a false positive victim of the Doppler ultrasound, and where essentially Kelvin Health saved his life. And over the span of these 3 to 4 years working with vascular specialists, we have collected over 10,000 samples from over 1.4 thousand patients. And we have collaborated with more than 20 hospitals around the world. And all of the specialists have been very excited using this particular solution in their clinical practice. They see direct value creation. They see a lot of improvement in the patient outcomes, and they see a lot of optimization of the patient journey of the hospital, leading to a lot of savings both on the hospital sides and the patient sides in terms of money, in terms of time, in terms of improvement in terms of benefits. So right now, we see that this solution has around 100% sensitivity and 6% specificity, which means that in just 4% of the cases where the patient didn't have any PID, we told the specialist that it had some kind of a PID, which is much better than in the cases where which is much better to have false negatives rather than false positives in this particular example. So yeah, this is essentially the impact that the technology has both on the doctor's work and the patient's health.
These illustrations are really amazing and explain everything, Georgi. So Kelvin Health projects involved annotating more than 2,000 thermographic images. What was the role of humans in the loop in this project?
Yes, so humans in the loop had a vital role in the success of the project. But let me first tell you what was the whole data collection and annotation process. So essentially, on top of the thermal scans that we collect from the 5 different angles of the legs, we also collect medical data for each of the patients. We collect patient profile data such as demographic information about the age of the patient, the gender of the patient, which is quite relevant, especially for PAD. We also collect information about the clinical profile of the patient, such as whether the patient had underwent any amputations in the past, whether the patient has diabetes, whether the patient has any other medical conditions such as chronic kidney disease, which could have an impact of the local body temperature. We also collect session diagnostic data such as what is the Rutherford classification of the peripheral arterial disease, if any? What is the BMI index of the patient? Has the patient been using any medications, and what type of medications? And most importantly, we also collect medical annotations for each of the arterial zones. So arterial zones are the zones that medically correspond to major arteries in our bodies. And essentially there are a limited number of arterial zones in our body, and we have selected 11 of them on the legs and 2 of them on the head related to carotid hyperperfusion. And for each of the arterial zones, we collect angiography information, whether this zone is normal, whether this zone has stenosis or thrombosis or complete blockage in the zone. And this information is then fed into the algorithm for training the machine learning classification algorithm that could quickly classify whether the patient has PID or not. But before that, in order to be able to do these classifications, we need an algorithm that could segment these arterial zones. And in order to be able to segment these arterial zones, we had to do a data annotation process on these segmentations. And this is where humans in the loop came in to help. They helped us collect segmentations of each of the arterial zones, both on the leg and the head. So on the leg, we collected for 11 arterial zones over 7,000 annotations, which led to the algorithm accuracy of 86% segmentation accuracy. This is quite high, for such complex arterial zones as those on the legs. And this is an example of the actual pipeline of algorithms working to classify the patient's condition. So in this example, we can see how the patient's arterial zones have been accurately segmented. Each of the arterial zones have been visualized correctly by the segmentations, and each of the segmentations also are being classified whether they have PAD or any type of blockage there, or whether this particular zone is healthy. And this is what the specialist sees finally after the algorithms completes working. This is what the specialist sees, and based on this information, the specialist decides what is the next best step for the patient. Should the patient undergo angiography diagnostics, or can the patient go, for example, home and for follow-up monitoring later in the year? And this is the zones, the segmentation zones that Humans in the Loop helped us annotate for the head region for the carotid hypoperfusion. So we collected 2 carotid zones on each side of the face, totaling in a total amount of 4 zones for each side. So left internal carotid artery, the right internal carotid artery, and left external and right external carotid arteries. And we collected over 2,000 zones annotations, which led to 99% of segmentation precision. And these high precision numbers wouldn't be possible without the expertise of the humans in the loop in this particular case. And this is again an example of the carotid segmentation zones working in practice and providing insights for the specialists whether the zones on the head are referring to healthy zones or those that could potentially have some blockages underlying related to the carotid artery.
Thanks, Georgi. Now I can admit that the technology is really promising. So the AI-powered application requires high-quality annotated data for accurate segmentation and precise identification of the anomalies. To what extent humans in the loop expert helped with that?
Yes, so the medical expertise of Humans in the Loop was quite instrumental for the success of the project. So without their medical expertise, we wouldn't be able to provide, for example, a correct guidance, technical guidance for the data annotators. So thanks to the medical expertise, we first of all cleared any misconceptions about the arterial zones, because there were some inaccuracies of the initially defined arterial zones by us. There was also some overlapping of some of the zones, which could potentially be correlated to some medical inaccuracies as well. So the medical expertise of Humans in the Loop helped clear all of these issues initially. Their medical expertise also helped us define very clear guidances and very clear requirements on how these zones should be annotated, how these zones should be distributed among the annotators, and essentially how to make this task as simple as possible for the actual technical annotators of Humans in the Loop. So I have to be very I'm very thankful for Humans in the Loop for providing this medical expertise in this particular project. Initially, when we started working with them, I didn't think that any medical expertise would be necessary in this particular project. But once we started working with Humans in the Loop, I immediately saw what is the value of having medical experts on Humans in the Loop side, and how this helps in the success of the project, and how this helps towards segmenting or annotating more accurate arterial zones.
Thanks, Georgi, for sharing your feedback. We are really excited to hear that and very proud to have a project like that. So now we would like to open the floor for some questions from our audience. Feel free to send us your question using the chat. So we will wait a couple of minutes for the question, then we will start with that. So let's start with the first question. What challenges did you face during the annotation process, and how did you overcome them?
That's a very good question. So essentially, the biggest challenge that we had is to accommodate the medical requirements of how these zones should be annotated towards technical requirements. And this is where the medical expertise of Humus Hindu came in to help. They very quickly understood what we want to achieve, and they quickly understood the whole problem of Kelvin behind Kelvin Health and what we are trying to create as a solution, and quickly and easily defined very simplified information that was then sent to the data annotators. There were also some challenges related to the actual zone annotations, because the zones are quite close to each other, so there is quite a lot of potential overlapping within them, which could potentially lead to a lot of issues later on by the classification algorithm that is essentially analyzing whether the zone has PAD or not, because essentially the temperature readings of the zones is quite important to be as accurate as possible for the accurate analysis of the algorithm, and that's why the challenge with the annotation was to make the zones as perfect as possible and as accurate as possible and as close to what the real medical zones are as possible. But again, as I mentioned earlier, with the help of both the medical and the technical expertise of Humus Hindu, all these challenges were easily mitigated, and we didn't have any major issues, especially towards the end of the project.
Thank you, Georgi. We are getting more questions now on the LinkedIn page. So how do you see the future of AI and the medical diagnostic involving?
Yeah, I think AI will transform the healthcare as we know it right now today, to the point that everything in the healthcare will be AI related. Everything will use some kind of AI to create insights, to increase to improve the patient outcomes, to optimize the whole patient journey. For example, AI is already being used and will be used more and more in different healthcare systems to create personalized suggestions of how the patient should and what type of procedure should the patient undergo. And this is all based on deep analysis of the medical records of the patient that are going over the years of the patient's life. And this is before AI, this whole process was impossible because in order to do all of this analysis of the patient records, one specialist or multiple specialists needed to go through all the records, all of the diagnosis, all of the patient's visits, the specialist visits that this patient had, to the point that they can generate some insights, some information of how the patient's condition has progressed over the time, and what is the best next step for the patient. And with AI, this could happen automatically in about several seconds to several minutes time, and this could lead to a lot of personalized healthcare suggestions, to a lot of personalized healthcare in general. And I believe that at some point in the future, we won't be using AI as an abbreviation anymore, especially in the healthcare systems. AI will be a commodity to the point that we'll be just, using it as, we'll be saying that this is a technology that we use rather than this is an AI system that we use. So everything will be AI related. The specialists will be deeply integrated with the AI systems. Actually, even currently, the vascular specialists use AI in their practice without them knowing that this is AI. So when they're doing the revascularization surgeries, they have a monitor, a display that shows in real time where they are right now doing the surgery in this particular artery that they're working on. And an AI system is constantly analyzing the procedure and giving some insights of what angle should the surgeon go into, or how deep the surgeon should go into during this revascularization process. And this is done almost like in a stealth manner, in an assistive manner, without even the surgeon knowing that it is being assisted by an AI system. So essentially, this is the future of AI in the healthcare system.
Yeah, that is amazing. So we have another question. How does Kelvin Health's technology offer its services? Is it to the doctors or the end user patients?
Sorry, can you repeat the question, because I didn't get that last part.
How does Kelvin Health's technology offer its services? Is it
Yeah.
the doctors or the end user, which is the patient?
Yeah, I have a slide for this. So essentially, currently, we see this as an assistive tool for the specialists and the healthcare providers, essentially acting it as a triage method in the very first essentially moments when the patient visits the vascular specialist. But we envision this product to evolve to the point that it is in the hands of the general practitioners. It is really important to be in the hands of the general practitioners, because this will allow for mass screening of patients with peripheral arterial disease, and not only peripheral arterial disease, but also with other type of conditions such as breast cancer or rheumatoid arthritis, especially if we develop the solution towards diagnosing these conditions. And being in the hands of the general practitioner, essentially, this not only could increase the screening procedures, but could increase the whole prophylactic procedures for each of the medical conditions. And the general practitioners will be able to have the power of the specialists in their hands without them requiring any type of specialist knowledge to understand what are the typical symptoms of the medical condition, and etc. And the long-term vision of the solution is as a device that is in the hands of the patient. Just imagine having this device at home, in your bathroom, and you being analyzed, your body being analyzed every morning before you go to the bath. For example, this could sit behind the mirror without you knowing that it is there, and just quickly analyzing you while you, make yourself prepare for work. And if in case that artificial intelligence finds any anomalies, they could, for example, alarm the general practitioner or your specialist, so that they can take precautions before it's too late, before any type of late stage of, for example, PAD or oncology diseases develop, and to be to early prevent these type of conditions, and to make these preventable deaths from these conditions a thing in the past, essentially.
Thanks, Georgi. We have another question from Aid. Thank you. He says that thank you for the amazing event. I want to ask, what is the annotation platform you used to annotate the images and the annotation tool?
So the annotation platform that we used was Supervisely, and we were quite happy that Humans in Loop offer annotations using this platform as well, because the type of Supervisely format annotations that we used was the type of format that our training platform or our machine learning training pipeline used as well. So Supervisely allows for very quick annotations, very quick visualizations, and even they offer automatic annotations in case you activate this feature. But most importantly, Supervisely, we found that Supervisely was quite fit for our case, for our use case of creating medical annotations of the arterial zones, because we could, for example, filter out the annotations based on the zones, based on the position of the segmentations in the whole image, and we could also integrate the thermal scans so that they could be easily visualized and could be understandable by the data annotators.
Great, Georgie. So we have another question from LinkedIn. Sarah says that Kelvin Health technology is amazing. Does Kelvin Health operate in Africa, and how I can purchase the software?
So unfortunately, currently we're still in the research and development phase, and we don't operate in any of the continents in the world. The research and development phase means that we're still training the machine learning algorithms, we're still collecting data, medical samples for each patient, and we're still improving the whole solution. The reason for this is that there is a strict regulatory requirements worldwide, not only, for example, in Europe or in the US, but also in Africa and Asia. Ethical guidelines that we need to follow, regulatory requirements that we need to follow. Essentially, we are required to provide evidence that this solution is safe for the patients, both in the healthcare systems as well as in other type of applications that this solution would be applied to, for example, in the primary care or secondary care. So this is our current stage, and we envision this to be completed by the end of the year. So hopefully we may have this solution available in the major markets around the world, around the globe, either by the end of this year or around mid next year.
So thanks, Georgie, and thanks for our audience for being interactive. We are getting one more question. Have you tried using any auto annotation features to label your data?
Unfortunately, we didn't use any auto annotation features. I mean, we tried to use them initially before contacting Humans in the Loop, but the type of annotations that we require and the precision that we require for these annotations made the project not suitable for automatic annotation solutions, such as the one that is offered by Supervisely or the ones that we try to develop internally. We kind of did for some of the annotations, but not the segmentation annotation. For some of the medical annotations, we kind of did a semi-automatic way of annotating them. But at the end of the day, it still requires some manual validation of these annotations, because the health of the patient, the life of the patients is at stake here. So we need to be aware of essentially what is the data set, how the data set was created, are there any biases in the data set, are there inaccuracies in the data set, and all these questions need to be as clear as possible and need to be as clarified as possible during this procedure. So in the future, we'll still be using Humans in the Loop for the annotations. For the future annotations, we won't be using any automatic means of annotating this data, because we require people that have expertise both medically and technically to make these segmentations as medically accurate as possible.
Thanks, Georgie. Our audience are really excited about the future of Kelvin Health. So we have another question. What is the Kelvin Health's next steps towards improving AI model, and how can HITL future further support your objectives?
Yeah, so first of all, as I mentioned, we still want to collect more evidence, more data that will support essentially the validation, the feasibility of this method, and the validation of this method that would later be used as a supportive documentation for regulatory procedures. And once we have FDA clearance, we'll go for some go-to-market strategy with integration with hospitals, EHR systems, and etc. But in the meantime, in parallel, we'll be definitely using Humans in the Loop for helping us with the data annotation, for the segmentation zones, for more data from patients, helping us validating some of the existing data that we have collected, and even helping us in annotating, medically annotating some of the data that we have collected so far. So essentially, Humans in the Loop will help us support the objectives of the regulatory phase, of the reimbursement phase as well, and hopefully to support us and help us reach markets much quicker than if we, for example, did the annotations ourselves internally.
Thanks a lot, Georgi. Do you have any other information you want to share with us?
No, I just wanted to share that we believe that a true unicorn company should positively impact the lives of billion people. So we're happy to that we're collaborating with Humans in the Loop, that we have joined forces with such organizations that could collaboratively and together help prevent the suffering of hundreds of millions of people and their families together. So thank you very much for this opportunity. It is such an honor for me to be part of this webinar series organized by Humans in the Loop, and I'm really excited that our collaboration has been successful so far, and really looking forward into what the future holds for both of us, both companies.
Thank you, Georgi, and thanks to our audience for your insightful questions. To wrap up, it's clear that Kelvin Health technology is making significant strides in medical diagnosis, particularly in early disease detection and cost reduction. Humans in the Loop's role in providing high-quality annotation has been crucial to this success. We are looking forward to seeing continued advancement in this field. Thank you all for joining us today.